workers from across the country are currently engaged in a 2-day workshop on intensive care units management as part of a COVID-19 response program. The program is a collaboration between the Ministry of Health and the Clinton Health Access Initiative. Speaking at the commencement of the workshop, Health Minister Dr. Frank Anthony noted that preparedness is important, since at the start of the pandemic, the health system was not prepared to deal with this, and a lot of adjustments had to be made. He noted that newer strains of the virus are still a threat.
If these strains become dominant and they have a totally different clinical picture, then we might have trouble all over again. And that is why we have to be prepared, because we don't know what these future variants are going to be like and whether they will cause more hospitalization. Some of the researchers are predicting that as winter is coming in some of the temperate countries, you will start seeing a new surge of cases. And if that is the case, then we have to be prepared, because during this pandemic, one of the interesting things that we were doing, when we saw something in the US, in 2 to 3 weeks' time, we will see it here in Guyana because of the connections and so forth. So if we start seeing a surge in the US, I think we ought to be prepared.
The health minister noted that even the current low numbers are not an accurate reflection of the rate of infection, since most people are mistaking the disease for the flu and not visiting health facilities.
While we're not seeing a lot of cases here, we must not be lulled into a false sense that they aren't cases. The big challenge that we have is that I think there's a lot of COVID fatigue, if there's such a term, meaning that people just fed up. Nobody wants to wear a mask. Nobody wants to come and get vaccinated. So we have this challenge. But we are going to see people getting sick anyhow.
This is just one aspect of the collaboration. Antigen tests were also donated to Guyana, and training in COVID-19 protocols for diagnosis and treatment, among others, were conducted.
I think also that the preparedness that we are working on now would help us to be better prepared for any future pandemic. And that's why these trainings are very important.